A one-day strike across South Africa today. Their demands include the permanent employment of all community healthcare workers by the National Department of Health. The union was set to deliver their memorandum in 8 provinces at district health offices, excluding Gauteng. For more on this, I'm joined now by NEHAWU General Secretary Zola Sapeta. Zola, good evening, and thank you very much for your time tonight on the Newsfeed Late Night. How did the march go today?
Good evening to you and your viewers. I must say that the leadership of NEHAWU were quite happy with an assessment that we have made today, because these community health workers, they went all out because they don't have an option than to fight for themselves. And we're quite happy with the attendance and the extent to which our members were so disciplined as they were expressing their discontent.
Now, this happens as the Minister of Health, Dr. Zweli Mkhize, plans to meet all MECs in the various provinces to discuss that very matter of how the community health workers can be employed. At what level would you want these workers to be employed at?
Surprisingly, is that we're expecting that meeting to take place today, but it happened to take place yesterday. And the MECs could not agree on the absorption of these community health workers, despite the fact that in 8 provinces, these ministers are drawn from the ANC, which is a ruling party, that had a manifesto for 2019 that said this current administration must employ more than 50,000. So we're quite disappointed to hear that this MEC could not agree, yet they are from the ruling party. And we don't know what then are they using to govern if it can't be the manifesto that they've sold to society and South Africans, that made South Africans to support that ruling party to be in government.
Does that affect your support for the ANC in any way?
Certainly, we would have to have a discussion in the union, precisely because we are seeing things that we have never seen before. Firstly, we had mobilized our members to support the ANC on the basis of that manifesto. That all of a sudden is going to be displaced by something else that we don't know. And the fact that the same government that we put together had reneged on the agreement in terms of the salary adjustment. So that warrants and dictates that internally in the union, we need to find time and to discuss whether this is a kind of a government or a political party that we want to be in government or not. But we are yet to have that discussion.
Of course, we know that community healthcare workers have been quite pivotal and vital, particularly in the first wave of COVID-19 in the country with the testing and contact tracing. We are on conversations now around a second wave. Will this affect the work of community health workers at all as far as not reaching an agreement? Will they be withholding their services, or will you be encouraging your members to do so?
Certainly. If you, as you are saying, in the first wave, they went all out through massive testing, and they went the extra mile. They were promised to be paid overtime. To date, they have not been paid the overtime, and they are under pressure because their contract ought to lapse early next year at a time where we are potentially will be confronted by the second wave. And most of them will lose their jobs because we are not sure of their job security. But of course, if government doesn't value their contribution and the essence of having them, why must we risk their life? Why must we encourage them to risk their life? Because it's quite clear they would be dumped immediately or in the midst of this kind of the second wave. So we'll encourage them. In fact, we will mobilize and make a point that at the time when they are needed the most, when confronted by the second wave, will discourage them from coming and also saving the nation.
Now, you've already said that meeting with the MECs happened yesterday. The MEC is not in agreement on how they're going to be absorbed permanently within the health department. What happens in 7 days if you do not receive a favorable response from the Department of Health?
The first thing that we have done today upon receiving that, we had assembled the legal minds to look into 3 important documents. First, the precedent that had occurred in 20 11, where government had employed these workers on contract. But secondly, we had asked them to study very closely the judgment of 2016, in particular here at Gauteng, with made government to absorb them at level 2. And then 3, we have asked our legal team to look into Resolution 1 of 2018, because that resolution, there's an undertaking to absorb these workers, and also agreed in terms of dealing with modalities. So we want to look into those things as one aspect that we have to look into. But the second aspect, we have been in touch with the Minister of Public Service and Administration, because we do think that he has a role to play, because this is a matter of condition of service, and primarily DPSA is responsible for that, particularly when there's an agreement. And the third option that we have at our disposal is to mobilize beyond this. And we have a consideration in our mind that we will be exploring in the 7 days, the solidarity strike. So it means we'll be talking to our members in health as a whole across the country, with a view of asking them to join this current strike of community health workers.
All right. General Secretary of NEHAWU there, Zola Sipata, appreciate your time and thank you for joining us tonight on the Newsfeed Late Night.